Get out of here.
No, she's recording for Lorena.
Oh, gotcha.
That's her assignment.
For her. Hi, Ashley.
I know it's awkward to get recorded, so
No,
if you're not comfortable with that,
totally,
I'm
whatever helps. I don't mind at all.
Okay.
And let me know if you need anything.
Okay. We'll work on you. We just gotta clean this up. Derek, I'm gonna have you go back into treatment. Okay.
You might set your stuff by the door.
Thank you.
Thanks, Quinn.
I need lotion.
Is there like massage lotion or just lotion?
No lotion.
Oh. Alright, we see. See that?
I was gonna cover up this bottom one first.
You're good. I'm just looking at it. Get your hand out of the way. Do you want to lay down?
Oh, okay. Unless it makes it easier.
Hey.
You need help taking this stuff to your car.
You can stop recording. Okay, so as in the previous video, I am using a 4-0 nylon monofilament suture. I am gripping it right now with the needle driver, and then I'm using the tissue forceps to manipulate the tissue as I drive the needle through. So previously we had so similarly to tie this knot, kind of come in on the first time and do 2 throws. Now with the mattress, you have to pull through a little bit more to approximate the edges. But again, we're gonna do a few knots here. To approximate. Then we're gonna cut this. And there we have our mattress stitch. So we can come again. So as you can see, it allows for some bubbling of the skin through here. So preferably I like to use the simple interrupted just because we don't get this bubble in here. as far as care for the patient's going to use a dressing over these stitches. So our patient has a laceration on her chin, underneath her chin, and she also has one on the anterior portion of her chin. So with both of these, she's going to use a dressing, a non-adhesive dressing to keep the wounds clean. She's going to check on these wounds daily, and she's going to make sure to be checking for signs of infection. So these wounds will potentially be discharging blood because they are acute wounds. However, she should be looking out for red flags as far as infection. And because this patient in particular we have assessed that she has a high chance of experiencing a concussion, we're going to be able to monitor her symptoms. She's going to come in daily for her graded symptoms checklist. So we'll be monitoring these wounds as well as her concussion symptoms. So the patient can shower. However, we want to make sure that these wounds stay dry. These sutures will need to be removed because these are, we used a non-absorbable suture. So we used the nylon monofilament 4O. So these will need to be removed. However, until then, the patient is urged to keep them clean. And again, we're going to be seeing her daily so we can monitor these wounds.